Awesome. Thank you all for being here. Let's talk about humidity, things sticking to the baby. Overall, kind of what is your plan to do with your ELBW, your elbows, your VLBW, those babies in humidity to get things to stick to them? First, we're going to talk about leads. So, the number one recommendation would be limb leads, the ones that kind of wrap around. You can do arm, leg. That's ideal. I will say, just like anything else, you cannot put it on and forget about it. It's just not a thing we do in the NICU, as we all know. And that's because they can move. There's a little, I don't know, I say gelatin. I know it's not gelatin, but soft thing underneath there that will move and become unattached from the lead. And then you have the lead directly on the baby. I've seen wounds from that. If we don't get it kind of on the bicep, we could also have the kind of cutting off that happens if it gets too close to where the baby's bending their arms and they're in that flexed position. So we have to watch for that as well. You should be having a change frequency. Every unit should have a minimum frequency at which they're changing their leads. You need to be checking under them, around them, and making sure they're not on too tight. Next, we had this great recommendation. We don't use leads. And I actually saw a lot of that. And I had 3 people that responded from Australia, which is wild and amazing and so cool that we're reaching Australia here and saying that they use the UAC transducer. I also had people reach out and say, our UACs don't pick up heart rate. That came from 3 different people. So you were not alone if you sent me that. I want you to know that your UAC should be picking up the heart rate. It's probably a setting on your monitor, and you need to get into your monitor handbook. I have used GE monitors, the Philips monitors, and those transport monitors. Those are the 3 ones that I'm most familiar with. They've all picked up the heart rate. You have to go in and set it. So look into that before you do anything else. If for some reason you still are not figuring it out, reach out to your manufacturer of both your transducer and your monitor. They should be able to help you. I know with GE, they have GE specialists that will help you with the whole setup with all of that. So look into that. Obviously, the oximeter is great, but if your baby has poor perfusion, that can be tricky if your oximeter is not picking up well. I've also had people say, I want to use the leads so that I can see the baby's kind of starting to space their heart rate, even if I'm not worried about the respiratory rate. You can see that on a UAC. Your blood pressure will also start dropping if your heart rate's dropping, right? Your blood pressure is a product of your cardiac output. And so if your heart's not beating as fast, your cardiac output's not going to be as good. Your blood pressure will be dropping. So keeping that in mind. When we talk about our UAC, UVC securement, overwhelmingly, the responses were to do a duoderm on the baby's skin and then get a little, wound up thing and put the tegaderm on top. I do think that works the majority of the time. I also think that the most success comes from skin prep and making sure that you're getting the skin ready to receive the duoderm. If you can do that, you're probably going to have more success than anything else. When we talk about the products, so first I want to talk about the Cardinal Health. Someone called it a football. No, they didn't say football. They said like the field goals. I always called it an Umbi bridge. It's foam and it's kind of squishy and the line secures inside of it. So you can see the numbers underneath and the numbers on top. So you can see if your line's in a good place. It's a great product. I've used it. It was my OG right. I used it for the 13 years I worked out in Seattle. I think it's a really great product. It stays on the skin well. I haven't actually had issues with it coming up. If anything, it can sometimes be hard to remove, but if you're using skin removal, the removal prep, it should be helpful to you. We also talked about the life bubble. The number one thing I didn't like about the life bubble was that it was hard to see your numbers. And if you had to do an adjustment, we did a trial on it at one of the units I worked on. If you had to do an adjustment, it was tricky to get in there and do that adjustment to the line. And so it felt more risky with CLABSI, I guess I would say, and hard to tell if your line was still at the right place. And then we have the NeoSmile brand securement, and I got a lot of feedback in my DMs about that. People saying it looks amazing, it looks like it should work, but it's not duoderm. It's actually a different product on the bottom and it doesn't stick well. That if it's an older baby and it can stick on, it's doing great. So maybe you could use that for your older babies. Comes back to duoderm, tegaderm. And I think also kind of sizing those down to the perfect size for your baby is going to be important to getting them to stick well. I also want to come back to this idea of how you can do a trial. So if you're on a smaller unit, you don't have a large leadership team, you can be in charge of that. if your leaders can't do it, your nurse manager isn't available, you don't have a CNS or an educator, ask anyone how I can go about doing a trial. You probably have a product selection committee in your unit or in your whole hospital that's looking into these, especially from a financial responsibility. There's usually a standard form that you're using for evaluation. So I reached out to the manufacturers and they will send you a certain number of samples. Make sure you have a good enough sample for your patient population. We did this for the temp probe covers, trialing out different hearts, if you will, to put over the temp probes to see what was going to stick best. I actually find that those slide around more than anything. I think those are one of the hardest things to stay on. And we also really know that thermoregulation is probably one of the most important parts of our job. So finding ways to safely keep them on is also going to be important. All that to say, there are great products out there. Comment below if I haven't mentioned something that you think would be a great product for anyone to sample. Let me know if you want some more specifics. It comes down to my number one recommendations for a final recap, if you've made it to the 6 minute of this video, is for leads, either use limb leads or no leads, especially if you have a UAC. And for your umbilical lines, the Duoderm with Tegaderm on top, cut down to the appropriate side with skin prep first. So keeping all of those things in mind, I love this engagement and I love that you're all thinking about it because A, you don't want to lose your line. That's a big deal. B, you want to make sure that you're protecting the infant's skin. C, CLABSI. I mean, they all kind of go together. That's not like one was more important than the other. They're all very important. The other thing is this length of time to use UACs. I worked on one unit where it was like we basically took them out the minute we didn't think the baby needed them. And I think UACs can stay in for a while. I love that you guys said up to 7 to 10 days in unstable babies, but why isn't that the norm more? Then we don't have to draw labs, leaving them in just for lab draws, leaving them in so that you can get your blood pressure if you're worried your baby's going to be unstable. I do know I'm not naive to the CLABSI risk. I'm not naive to the nutrition risk. I know that all of those things exist, right? But if you are passionate about your CLABSI, it's probably not going to come from staying in too long. It's about your skincare, your skin, your line care practices, and nutrition. You can get very low volumes of fluids running in there just depending on what you're doing with your heparin. So investigate those things. Anyway, thanks for joining me today. I hope you enjoyed this video. It's nice and long. And comment below. This is not a typical video from me. I will post on YouTube if you want to refer back to it. But overall, I hope that you got something from it and comment. This is how we help each other kind of go back and forth. And have a great weekend.